2, which is the debate. So I'm going to ask my fellow panelists to join me. I have Amir Akhtar, which is coming from the Emirates for us. Stanislaw Radomiński. Thank you. John Mulcahy. Did I say that correctly? Yeah? And Maciej Malenda. Okay. Do you guys have... hi, Maciej. How are you? Finally.
Just one thing. My name is Ammar Akhtar. Ammar.
Please?
Ammar Akhtar.
Ammar Akhtar. Sorry, I'm really apologizing for my inability. I'm going to get a bit closer since I don't buy it. So, you guys are ready? You guys are ready? Okay, I'm pretty sure. Okay. Now, I presented telemedicine example, but of course, we are here to talk about healthcare. I like telemedicine because it provides an open. It closes a bit the door to AI, and feel free to, bring it on whenever you want. But my first question to you is, in the next 2 to 5, what do you think are going to be the technologies which are going to change the landscape of healthcare, and why?
Hello? Yeah. If you see, we are going through a very big change in terms of technology, and these days, it is the most personal thing with us. So for example, we have these assistants, we have the wearable tech. It is very personal to us. It is what we wear and we move with, right? And that hardware, that device, generates something that is called big data. It can be used or it can be unused, it can be offline or online, okay? I think big data is very important for healthcare. If we use it correctly, it can really create a lot of information, right? That companies, pharmaceutical companies, hospitals, medical centers can use. So for example, if I'm a very agile person, right, and I get sick and I go to the doctor, and imagine the doctor has some dashboard where he has information about me, what I've been doing in the last 2 years or so. He knows my sleeping habits, he knows how many steps I take every day on average, and he knows a bit more about me and my heart rate and my average heart rate per day, for example. He can, I think, do much better with my sickness, with my problem of health, than me telling him that, yeah, last night I slept late, or I got the flu or something. So I think this information that can be generated by these devices, right? I think we haven't really leveraged those as yet. It's still the beginning thing. And I hope we can make use of this very enormous amount of data and energy and convert it into a much more positive energy.
Hello? Yeah, I'd like to follow on what you said about the data. So in my opinion, the personalized drug therapies will be the thing. Because when you have all this information, it might be, or it is possible right now, to produce a drug that is especially for you. So based on your current state, your personal, or your body basically, and what you need at this particular moment, it will be possible to print a drug for you. The first 3D printed drug was FDA approved in 2015, so it is possible. And this will change the way we use the pharmacotherapy and the way we treat our diseases with the personalized and targeted drug treatments.
Yes, so the technology which I believe will be important in the next 2 to 5 years are, first of all, chronic disease management enabled by digital health. I've been working in digital health since probably 2001 in some of the original systems, but now I think we're coming to a point where we've learned from the first generation, second generation solutions, what really works, what doesn't work. we can see, say, in the last quarter that there's been the largest amount of investment taking place into digital health and digital therapeutics that has ever taken place, as companies go into the validation phase as they can complete their clinical studies. We also have the ability to understand now how to drive behavior change, what types of interventions are required to get consumers to adopt healthy behaviors, and combine this with the information coming from devices, with the information coming from patients' day-to-day activities to actually impact on their day-to-day care delivery. I believe that it will be much more impactful to basically do that on day-to-day ongoing chronic disease management and then say the diagnostic phase of care delivery, because in the ongoing care phase you can already have had that discussion with your physician. You can build a personalized care plan, and that can then guide the treatment for the patient going forward.
Okay, so as I'm the last one, and the guys before told all the great thing, one thing I can do is I think I can follow up on John, because I think it's not only in the disease management on the problems that we already have, but also with the prophylactic care, because we have more and more devices. And normally, if we don't have a problem with the physician, we are going to the physician for twice, maybe 3 times a year. So it's really, really rare. And yes, the big data, and yes, we need to use that. But I think without the devices, without the personalized devices that we will be using every day, we will not have a lot of data to think about or to analyze. So I think the biggest change for the next 2 to 5 years will be the personalized devices for all of us. And most of you probably is wearing now some kind of Apple Watch, Fitbit and everything else. But I think it will be focusing more and more into this side, to the personalized healthcare from the start, from the prophylactic care till the end, till the very last problems that we have.
Then my next question is, going back to artificial intelligence, because none of you actually mentioned blockchain. And both of them, there is a lot of hype. So is it just hype, or we are too far away?
Basically, we have to understand one thing, that blockchain is not just about a currency, it's not about cryptocurrency, it's a framework. It's a framework where we can do amazing things, okay? But it is something that is still, I would say, under scrutiny or under some sort of check. So, for example, I see blockchain can do amazing things for healthcare. How? For example, if you see a lot of countries, they have medical insurance not mandatory. If you don't have it, it's okay. I mean, you can die wondering, it's fine, unfortunately. And 68% of the world is considered as low income or poor, 68%. So there's a market that has no access to healthcare. It's a very big market. I would assume creating a blockchain-based network or a network effect where I can see, okay, this guy comes to the doctor only twice a year, okay? And he comes to the doctor 30 times a year. So my medical premium, insurance premium, should be higher than yours, technically speaking, but it doesn't happen that way. I mean, okay? So blockchain can really help, that framework can really help, and can have this data of this person, this person, this person, based on that whole network effect, it can help. But I haven't really come across a system as yet where I see, okay, blockchain for healthcare, okay, this is how it is going to marry. It is still something that we have to explore.
There's a possibility of creating an open and safe and accessible database of all the healthcare data for basically everybody in the world. So it's not going to be a technology that it's forcing people from less developed countries to start using this, because it's accessible and it's basically can be used anywhere with any device. So I think this is one of the ways that blockchain technology can be used for healthcare. So safe and an accessible database.
Yeah, so you mentioned 2 things. One was AI and the second was blockchain. On AI, we have, so in the programs I've been working on, we have actually been using AI. I think it's important in 2 ways. One is, if you're looking to provide chronic disease management, provide personalized care, you do need to find that appropriate nudge and that appropriate way to engage with the person on a psychological level. And that requires insights on where that patient is from a mental perspective. And AI can help us do that. So we're looking to basically use AI and machine learning to identify what is the behavioral and, I guess, psychological profile of the patient, and then tailor the messaging to that patient's needs. The second area then with AI, machine learning and data science was also to try and figure out when a patient goes to their doctor, what's the insight that the doctor needs in order to have the appropriate conversation with the patient. So, you know, most healthcare systems, there is a limit to how many times a patient can visit. It's not a patient choice, it's also driven by the healthcare system itself. So that the physician coming in, instead of having to do, say, history of present illness conversation with the patient, wanted to actually bypass that, look at the longitudinal information, also say, for example, I've got this patient coming in who's suffering from depression, who's suffering from a cognitive impairment in addition to their chronic disease. Now, what are the key things that I need to talk to them about? And data science can help with that in machine learning. Having said that, there are then elements of care delivery which can be enabled by artificial intelligence and machine learning, but that probably comes later. That comes after you've actually rolled out your pilot program, after you've learned what works in the field, which parts can be automated, which parts can't be automated, which parts you still need, say, nurse call center support to support the patients. And then to automate the parts which can be automated appropriately. On the blockchain side, I think the jury is still out in blockchain. You know, there are a number of use cases where people are saying, hey, blockchain will be fantastic for things like, you know, proving the pharmaceutical supply chain is valid, that the drugs are current, etc., physician credentialing, and, you know, providing a single source of truth around a patient record, for example, which are all significant challenges from a healthcare system perspective. And people are looking to try to run pilots of blockchain. But so far, until we see success in those areas and until blockchain proves itself to be a game changer in those areas, I don't think it's going to see broad adoption. There'll be a lot of institutional challenges to people taking it on. There'll be a lot of resistance. And the technology itself will have to prove that it's able to scale up to the number of transactions required to actually deliver healthcare at scale.
Yeah, so John, you ended with the healthcare at scale, and I think this is the problem with the blockchain. So we are on the place that the blockchain will be needed when we will have a scale, when some country or the group of countries will decide to use blockchain as a platform. Before that, there is no immediate gain from using the blockchain, because this is the platform. I like the comparison of blockchain to the Internet of Value. Is the Internet 3.0, not something new. It will be at some point like the TCP/IP protocol, and that's all. And we will be using the blockchain as a basic for anything that we are doing. But to do that, we need to have the scale, and I am saying about the scale of a country at least, because in the smaller scale, we were trying in Medicover within 1 million patients, and we said it's too small scale to do it, because there are easier solutions, more accessible now, more proven for now than the blockchain. And with the AI, I think the problem is here with the narrow AI. When we will be going more into general AI, the AI that will be able to answer more questions and be more humanized, then it will be on one hand more feared about it, and on the other hand will be more willing to use it. For now, it's also a lot of jobs or a big job to create the good AI system.
I think that's very interesting. But let's step back to what he was saying before. You know, he was talking about how we can make healthcare more inclusive. What are other examples of technologies that can help achieving that or bridging that gap?
The biggest example that comes to my mind right now is I've been watching, you know, what's been happening in India in the last 3-4 years with a new government that they have formed, and they have done some amazing work with healthcare, where they take 0.010 zloty. I'm comparing it with the currency per month from everybody, and they give them the basic healthcare. So, for example, you can go and see ENT, or, you know, for your fever, you can go and see the doctor for free. And they have done this using a scheme called Digital India, where they are giving every person a card based on NFC, right? So they go and they just show the card, and it's working. It's working really well, and it's growing. I think that is very interesting because such a big economy as India, for example, and they have done that. I think we as thinkers or companies who create a lot of medical stuff, medtech and work in telemedicine can really see it as a model and maybe enhance it, in other countries and see how it goes, because it is happening and it can grow further.
Yeah, I would say the IoT or a lot of devices that are present right now that can be used to make healthcare more accessible in basically any part of the world. So you don't have to see a doctor, you don't have to travel a lot to get a diagnosis. You can use the devices. You can have centers in even small cities or small villages where you can just go and consult with the doctor. So I think this is one of the ways you can get people to be included in the wider scope of healthcare.
Yeah, and building on that, I think if we look at some of the things which I think will be super exciting is delivering chronic disease management using digital health. It will involve bringing in data from devices, but I think also in building digital health, you can achieve all three sides of the classic care triangle, which is high quality care by having care pathways which are localized and personalized to the patients, so that essentially you can build in best practice into your care pathways and care plans. You can address the access challenge, which is by providing care both to kind of communities that are underserved in your cities, but also people who are remote from clinical care equally. And also it can be delivered in a cost-effective manner because it is delivered in the home environment or in the community environment. And it enables you to move healthcare out of, say, a pure hospital setting and into the home or community setting. So I think that's a way to drive inclusivity and to help people. And if you look at the types of disease supported by these solutions, they tend to be CHF, COPD, diabetes, where the burden falls predominantly on the lower socioeconomic classes. So I think it's an area where we can really make a major impact on the healthcare of people.
Yeah, so I don't know if I can add something to that, because this all provides we will have I think the more access to the internet-based solutions, to digital solutions will help us gain all as a healthcare community. So that's all I think.
Okay, then I'm staying with you, Maciej, for a second, because you talked about scale a couple of times. So what's the importance of building a digital ecosystem? Not as a player, of course you guys are an important player in healthcare in Poland. You're doing your own things, but what the examples I was talking about earlier, open APIs, it's not the player coming up with, it's a cooperative, it's an ecosystem. So how it is important to achieve what we want to achieve, and how do we build it?
So I think it's and I'm not speaking as a provider probably, but I think we should all be open, because we are building the greater solutions for healthcare all over the world. So on one hand we need to be open and we need to have the access for everybody the same. And as we are now so advanced and we have so many possibilities to have access to the healthcare, it's hard to be closed, and it's not I think it's not good to build a competitive advantage on closing on, but it's more rather to be open and to have solutions that will be that people will be willing to test and use, and not say like we are the only ones. No, let's be open for everybody. Let's have the most possible solutions included inside. So rather than providing our own hardware systems, let's use all of them, and let's be able to connect with all of the systems on our digital system. And on the other side, we are working on the interoperability around the Poland and around the Europe, because we think like the cross-border care or the interoperability between the countries, between the cities, between the clinics even, it's really important to have this really personalized care with one app for any person in the world.
Is that an easy pitch?
Sorry?
Is that an easy pitch?
No, no. I think it's the hardest bit.
Okay. Now, John, question for you. When we talk about digital, it's easy to get, let's say, swamped with bits and bytes and exciting technology, but we forget very often about the human side of it. And I think you have a lot of experience with that. Can you provide an insight?
Yes, so I think it's not really about the technology. The technology is important, but the technology is an enabler to delivery of care. And you know, what's important is that the services that you build enabled by the technology, and you need to ensure that they work for the various people who are experiencing those services. That's the patient, to build patient-centered care, but it's also the providers who are working with the patients themselves. On the patient side, you know, if you're looking to drive improvements in care, you need to get adoption going. So you need to make sure that patients actually adopt your solution. You need to learn fast from how they actually work with your system and your solution. So that needs to be built into the way that you've actually designed your solution and the services that wrap around it. Often as technologists, people get caught up in the technology and they build solutions which either don't work from a patient perspective or can't be deployed into a healthcare system or will generate a lot of resistance and pushback from HCPs. And as startups, I think it's important to ensure that your solutions overcome these issues. And you know, often when you come to these kind of conferences, people have fantastic stories about why they actually start up their companies, what drove them, what their personal story is, and that's part of it. It's basically that understanding of the disease, of the need is a key part of enabling care. But it's not enough. You need to then, you know, engage closely with patients and engage closely with healthcare systems and HCPs to actually ensure that your system will work for all those stakeholders as well.
So, and this is open to everybody, how do you then get, you know, people, let's say, involved and buying into the technological aspect? Because technology means change for the doctors, means change for the healthcare operator, means change for the nurses. You guys are working on changing how the pharmacy works. But on the other hand, we need to convince the technologists as well that there is a human dimension. So how do you strike a balance?
Yeah, if I may. So there, on the adoption side, I think it's really important when you start off your program to have a couple of pilot sites where you can essentially work with clinical teams to understand that adoption and have them as reference sites to test to believe in your technology and test your technology, see does it work, learn how to improve it, where they also understand that the initial success or failures are part of a learning journey and where they're in that with you for the longer term. On the technology side, you know, when I've worked with teams, I've always tried to ensure that the engineering teams understand the therapeutic area, understand what's required to deliver great care to patients, and where they start to see what's required from business process, from clinical process to actually deliver care. And so it's really important to expose your technologists to that part of the equation, so they see the experience through the patient's eyes, through the HCP's eyes as well, and aren't just kind of sitting in a cubicle writing code divorced from the end usage. You know, one of the things I really like to do is also ensure that they learn the therapeutic area, but also take part and observe how, you say, your human factors testing is going, see how end users are really using the system, and you should always, you know, when you're doing your human factors test, ensure that basically you've got an agreement that it will be recorded and live streamed so that you can actually have your teams seeing how do people actually work with the system in real life.
I'd like to add one thing. From our experience, it's the hardest part, I think, is to convince people that the technology will not take away their jobs. The technology is to make their jobs easier or take away all those dreadful tasks they are doing right now, like, for example, preparing the drugs for the patient. This is what most nurses do in Poland. And so they can see, okay, we can stop doing that, so we can start taking better care of a patient. Or we can use the technology to give the better diagnosis, or spend some time with the patient to get to know, based on the information we have, what's really wrong with the patient. Is it going to be a new drug or a different drug, or maybe it's not a pharmacotherapy at all, but some other settings we have to take into account.
Yeah, so if I could add something also on it, that's when we are looking for something new and we want to adapt something new, we always look for this 5% of people that are innovators, rather it's physicians, doctors, nurses or patients, because we know that they will be willing to cooperate, they are willing to test it, they'll be the first testers, and they know that there will be the flaws, the failures and everything. But we always see this sweet spot when they see like, it wasn't good, but now I really love it. I really love it. And they are not then going to the friends that are saying this first users, this 30% group, and they are selling it. So we are trying to find the people that are willing to sell our idea with us.
Early adopters, basically. What you guys have touched on is the importance of building awareness with the right groups. How do you build effective awareness campaigns with the patients, with all the stakeholders, in a way that change is soft and it's perceived for what it is and for the benefits it has?
Well, thing is that you have to keep it very social, okay? So we have been working with a company in UAE, it's called Pink Caravan, and their job is to create awareness for breast cancer, okay? And it's a topic that is, I would say, very technical. Not everybody knows about it. So what we have done is we create a social campaign, okay? And we call it Become a Soldier of the Pink Hope. It's a campaign that we have created where you as a person, either men or women, that's not a problem. You can share the message that we are giving across, okay? And we created a mobile app where you can actually examine yourself for breast cancer. So it has some kind of animation where you can do a BSE, the self-examination, and you can see how it's going, and you can book a consultation, okay? And then we talked about the mobile clinics where we can take those clinics to the rural areas, okay? So we have a mobile mammogram van, okay? Where we have, in UAE, there are some places where still people are living in a bit older sort of era or age, and we take those vans there and we create awareness. But social was a very big factor about it, plus the design. We design it in a way that it's not talking about disease. It's a news. It's giving a news. It is like a product, for example. So the design was very important, plus the social aspect of it. We use a lot of Instagram stories and Facebook stories for that, and it is really working. It's been 4 years now, and it's growing. Yeah.
Anybody else? Then we talked about early adopters, awareness, change is difficult, but I wanted to ask a question to Stan, because healthcare providers are very process-oriented. And on one end there is compliance, there is regulatory, but as well there is efficiency and cost saving. So how do you use technology, and how can Internet 4.0 come and streamline processes in an hospital? You have direct experience with that, I believe.
Yes. So basic idea is to exchange information, so you can use this information to provide the care, so you can be more efficient. Another thing is how you gather this information. So, for example, in our case, we have to prove that the right drugs went to the right patient. So we have to authenticate somehow the patient. So right now we use barcoding or 2D coding, but with the use of sensors like tattoos, like those the ones you presented. We can identify the patient without the risk of, okay, somebody took a bracelet of one patient and took it. And also, right now we can trace the drug until it reaches the patient. We cannot say if the patient actually took the drug or not. So with those digestible sensors, for example, we can make sure that, okay, this patient took this drug at this hour. So basically, yeah, we have to find a way of or make a roadmap of how we use this technology to make in our case, the drug delivery the best it can be. So it is easy to use and unnoticeable for the patient, and on the other hand, 100% bulletproof, and we know that we are doing the best we can to the right patients.
And you guys, anything to add? No. Okay, so we have 5 minutes left, and I want to take this opportunity to ask you one final question to all of you, because all of you have your own experiences, but you come from an entrepreneurial ecosystem from a different country. So we have Poland, Great Britain, Poland, and Emirates. So why should a startup decide to start in Poland versus Great Britain versus the Emirates? What's your experience? What are the benefits and what are the limitations?
Okay, Emirates is a very young country. It's been 47 years into existence, became the Emirates, and it is a very dynamic, culture, because it's building. Very much like Warsaw, after the World War, you guys have built a lot of things, right? So here in Dubai also we are building a lot of things. We are building new processes. And good news for the medtech startups is that since last year, medical insurance is mandatory. You cannot live in Dubai without the medical insurance, and that means you have all the people who can have access to what you are providing, right? And all you have to do is reach the market and see how you can sell it. And last month we have Arab Health Exhibition. It's an official exhibition of the UAE for the medtech, and there were many companies from UK, from Europe, and they see it as a very big market for the medtech, right? And the very interesting part about Emirates is that it has medical stacks. So you have a VIP insurance, you have a VVVVIP insurance for royals, and then you have a normal insurance, right? So the affordability is there, what I'm saying, right? And it's a very interesting market. And of course, there are no taxes.
Drawbacks?
Drawbacks is it's a very small market. So the competition will be saturated.
Fair enough.
One of the things we found good for our company is the accessibility to hospitals, because we've been to the US, we've been to Emirates, and it's relatively easy to get into a hospital, to talk to the right people, to the pharmacists, to the nurses, even to the directors of the hospitals, introduce the idea and get the green or red light. It's relatively easy to basically to sell your idea and say, okay, we have this, we provide you with this, are you willing to test it? And in my experience, it's quite easy to do it in Poland than in Germany or in the US, for example. So this is one of the ways you can get a proof of concept or show, okay, it's working, and then you can move forward.
Yes, so I'd like to build on what you said. I agree. One of the key things is this question of access to market. And wherever you decide to start up your company, if you're in medtech, you're going to need a way to basically access the major markets. So you can start your company in Poland, you can start in Orange, you can start in Emirates, but ultimately you're probably going to need to be able to sell into some of the major markets. So you're going to need a US presence at some point. You need to get into Canada, and the other big 5 markets are going to be critical for you in order to basically make a global scalable business. So there are advantages starting in Poland, which is the access question. There's great talent here as well, which I think from a technical perspective, but I guess some of the gaps will be in terms of, say, some of the disease understanding and some of the access to people who can really pay for the solutions. And then you asked why establish in Ireland. In Ireland, there are reasons to establish in Ireland. That's around the government is very supportive, there's low bureaucracy, and there's significant incentives for companies setting up there. and there's a big focus on medtech and AI within the Irish environment, and low corporation taxes. So those are some of the reasons for establishing there. But the labour market is tight, and the engineering market is tight. But there's a lot of pharma and medtech there, which at least means that you're hiring people who have that medical device development experience and exposure to some of the pharmaceutical companies, but typically not the access side and the decision makers either, and the local market is almost nil, basically. It's really small as a disadvantage.
So adding on Staszek, I think that Poland is a ready country for the innovation, and because we were so late in the start of innovation, because we started in the 90s, many of the hospitals and the clinics aren't very prepared for the technology even. So there is a lot of space to improve. And on the other hand, we have a 38 million people country. So we have a lot of people that need a healthcare, and it's with a really high standard healthcare. So I think especially for the startups from the medtech or the health tech, it's a really good place to start, to test, to have the pilots, to show the immediate results, because it's like the small twitches here can result in a big changes, and then to scale up in other countries.
Cool. So 20 seconds before, so we are actually on time, and I wanted to thank you guys for joining me today, and thank you the organizers for this. So next. Sorry, Ireland.
No problem. I'll forgive you.